Hey, hello. Happy to have Dr. Thann today with us at Cure booth. Dr. Thann is a young physician, started almost his career 10 years back treating TB and HIV patients as a general practitioner, and then moved to multiple organizations which was implementing big projects, including Challenge TB. He was with Union, and he was now with PATH as a program manager of TB and HIV. I know that PATH has been a critical partner in TB control in Myanmar, right?
Yes.
And you have been doing TB Reach project a while back, and you had a lot of experience in engaging private sector, working with the private medical association over there. Could you please explain that the use of AI and X-ray screening from your TB Reach experience and how you benefited that for scaling up in other projects?
Yes, thank you. So first of all, the TB Reach Wave 7 project, which is collaborated between PATH and Myanmar Medical Association. Myanmar Medical Association is mostly organized by all of our professional doctors in Myanmar. So, and in collaboration with the Myanmar Medical Association, we implemented chest X-ray CAT, very first chest X-ray CAT project in Myanmar. And in this project, the CAT is one of the innovative intervention for the household contacts, and also the walk-in clients to general practitioner. Sometimes we go private provider. And this project, this project lasts around 1.5 years. We have very good experience with the QR AI for detecting and screening TB patients, and also we have evidence, such kind of evidence, and also selected in the Union conference in last year. Yeah.
Perfect. So, I know that you use digital technology as a means for engaging the private sector, and because the private doctors always prefer X-rays, and so you thought, okay, X-ray with an assisted AI will be a good tool to engage with them and increase the case finding. Do you recall any number of patients detected and how it helped you in increasing the notification in the country?
Yeah, sure. So even though our projects had implemented during COVID and also our political instability in Myanmar, we have such kind of improvement in TB case detection. I think that we screen more than nearly 3,000 contacts, and also some nearly 1,000 walk-in clients by AI chest X-ray, and that we have some very good feedback from our private doctor. This is very supported for their clinical decision regarding the TB case diagnosis or something.
Perfect. So almost 4,000 clients were screened, and you use household contact and the walk-in clients. And also you kind of position this as a mitigation strategy of when the government functions were interrupted, you latched on to private sector to actually kind of fill that gap. Wonderful.
Yes.
I appreciate your work in during the conflict, and then using this as a gap filler.
Yes.
So now that you are also exploring active case finding through your existing USAID grant, could you please also elaborate how you are leveraging AI technology and also ultra portable X-rays in your new grant?
Yes. So we had a great experience with the chest X-ray AI, and like the cloud version in our peri-urban setting. So that we plan to scale at that approach to other hard-to-reach area, and things which are limited radiologists. So that in our new grant, USA grant, we had planned to use the chest X-ray offline version to increase to accelerate our TB case finding.
Yes. Do you have any numbers to share?
Yes, I think so. We had implemented nearly 1 year. I think more than 1,000. I think 10,000 or something like that. I think that there are 3 implementing partners are implementing.
Okay, great.
Correct.
So if I understand it correctly, so if I recall the numbers when I was in PATH, you also use the technology in pediatric population, right?
Yeah, sure.
In the private sector. So do you have any experience in sharing that information? Because I know there was some encouraging results coming out of it. The same algorithm applied in the pediatric population as well.
Yes, we even though we have such pediatric population in TBD with 7, but there are a few number. So that we are trying to evidence in our new grant for the pediatric population. Now I think that more than 600 pediatric cases are registered in our AI. Yes.
That's a perfect example. Coming back to Yangon, I know that Yangon is a high burden setting, and with slums, you have pockets of MDR TB burden also. There are plans to actually have a zero TB initiative in Yangon. Was there any progress made? I know that there are active case finding. The slums was also planned. So, do you have you initiated any steps in addressing that gaps during using the USAID grant?
As sure. So in our USA grant, we are also reaching like the migrant population and peri-urban, because some of the Yangon region are overcrowded with such kind of population, and we in our not only in our new grant, in other grant, we are also reaching like the migrant population. Yes.
So you're focusing on migrant population screening.
Yes.
Using X-ray. So you're not initiated, but again, you are actually expanding the services to that.
Yes.
Correct. So it's a good way to look at leveraging the technology. So on the other side, you know that the capabilities of what we are offering is just not beyond tuberculosis, right? There are other lung health situations like lung nodule detection. There is heart situations like cardiac shadow detection. So I recall that in your last proposal to TB Reach grant, you were thinking about the integrated care delivery platform. So are you still having thought process on that, and what was it? So I know that this was rated as a very rich proposal from the standpoint of idea and integrated care delivery. Have you started that project yet, or you're still in the making?
Our TB Reach with them project has started, I think, since April 2022. In our integrated proposal, we included COVID-19, HIV, mandate health, and also HCV. And that project, I think that we trying to utilize or optimize uses of the CSAC AI and collaborated with our USA grant.
Okay, great. So it's a nice way to look at. So you kind of had a proof of concept initially with working with the private sector, and had seen the technology, the advancements in the technology. Then you actually expanded that to your outreach case finding. Then you expanded that to migrant screening. Now you package that into integrated care delivery. This is fabulous, because this is how we need to expand beyond diseases and think about universal health coverage. I think the thought process over there and in your organization and PATH's focus on primary health care very much fits into that. Do you have any last thought to share? How do you want to take it, the learning from Myanmar, to take it to the path other countries, and what is the mechanism you're thinking about how we can expand beyond Myanmar?
Yes, actually, I think Myanmar is one of the most difficult countries to adopt the new tools.
Okay.
But I think
But you've done that.
Yes, we did it. I think I encourage people or every TB practitioner to use like such kind of the advanced technology to accelerate our TB case finding activity. I think that this is my
Wishing
encouragement.
all success, and also I would strongly recommend you to publish the papers of the previous TB Reach and also the USAID, because which will add a lot of value to the larger population around for TB control and beyond. And for PATH, I know the focus is on primary healthcare. Your integrated healthcare delivery experience will benefit PATH in expanding that to other countries. Wishing all the best. Thank you so much, Dr. Thann, for dropping down to our
Yes, thank you.
and continuing to support us.
Yes,
Thank you.
thank you.